Good morning. I apologize, I cannot speak in Hindi. It would be like a 2-year-old. So thank you very much for this honor. Thank you, Dr. Karma, for putting this together. And I look forward to learning more about Vedic jurisprudence. That is not my area of expertise, but I have been asked to come and say a few words about the role of religion, morality, and ethics in public life. And I really think that's something that all of us should be very concerned about. And it's something that I've put a lot of time into and thinking about in my career as a bioethicist and as an applied ethicist. So let me begin with emphasizing that religious studies, in the field of religious studies, there is not an agreed upon definition of religion. So think about what that means. Right? If all the scholars that come together in the world cannot say that religion is X, that means it's really complex. And over the years, I have been collecting definitions of religion. And right now I have a list that's about 64 definitions. And it's by no means comprehensive. Right? So there's a lot of ways we can look at that. And if it's complicated, well, life is complicated. Right? I'm like I said, an applied ethicist. And that means I want to take what I learn and what I learn in philosophy and theology and apply it to how we live in this world. And you all know life doesn't fit into nice little neat categories, right? It's messy. So when we talk about religion, which is part of life, it's going to be messy. A lot of times people choose to use the term spirituality rather than religion. And when we do that in the United States, yeah, this is kind of, how about if I do this? There. Now I can see you. Okay. In the United States, you often hear people saying, I'm spiritual, but I'm not religious. And if we think about what that means, a lot of times that means they're kind of putting aside or even outright rejecting institutionalized, formalized religion. And that can happen, right? And that's often a thing that happens. But then that doesn't mean they're not concerned about the larger questions in life, the meaning and the purpose, and how they're supposed to live their life. And oftentimes spirituality is where those questions come in. And they fall under that, where it's dealing with that transcendent realm, which sometimes we'll refer to as God or gods, or that metaphysical, right? That which is beyond the physical reality that we see and we engage. And others talk about it as something within, right? The Atman, the soul that is within. And when I teach my students in the States, we talk about the jiva. And in Jainism, it's an actual thing, right? It's a physical thing. And I said, but if you dissect a human being, are you going to see a jiva? You won't, right? So it's still a metaphysical idea. This really gets at the heart of how I define religion. Religion are human attempts to understand, to grapple with, and to engage that transcendent, metaphysical inner spirit or inner idea or inner existence. Sometimes these attempts at understanding and engaging get institutionalized and become formal religious traditions. And other times they don't. Again, that's why it gets so complicated when we talk about religion. In their institutionalized forms, religions can be a powerful tool. And think about how powerful and how inspirational different religious traditions can be for people. It can be a powerful tool for good or for ill, to bring about freedom or oppression. It all depends on how we choose to implement this tool that we call religion. Consider Reverend Desmond Tutu. He's the bishop, the Anglican bishop in South Africa. And I'm sure all of you have heard about him. He's a delightful human being. And I was in graduate school and had the privilege of listening to him address us. And he was talking about the equality of all people. And he starts to tell the story. And if you've never heard him tell stories, go on to Google and Google Desmond Tutu and just watch. He's got this infectious joy when he tells these stories. And think about the context out of which he's coming. Right? He's a black South African, and he has all this joy that he's sharing in spite of all the experiences that he's had. So in the talk that I heard him when I was in grad school, he was talking about the equality of all people. And he tells the story of this African woman and her son. And they're walking down the road, and they get to this checkpoint. And there's a white South African guard there. And he looks at the woman, and he spits in her face. And he says, "You're a dog." And she looks at him, and she holds her head up high, and holds her Bible, and says, "I am a child of the living God." And she walks on, knowing who she is. Consider also Timothy McVeigh. Some of you may remember in the mid-90s, he was in the United States, he was a white nationalist. He too was motivated by his religious convictions. However, he drove a truck down into downtown Oklahoma, and he blew up a federal building, killing over 168 people, some of whom were kids, because there was a daycare center in that building. And I think over 680 people were injured. Both of these people, the black South African woman and Timothy McVeigh, found a sense of identity in their religious traditions. However, they used it in very, very different ways. Remember, religion is a tool that people use to try and explain the world around them and their place in it. It can be utilized to bring about anything between peace and war, freedom and oppression, and it all depends, again, upon how we choose to use it. Notice I'm focusing on this idea of our choice. As an applied ethicist, I think it's very important that we take responsibility and be mindful of the choices we make as we live in this world. My focus and my concern as an applied ethicist who examines ethical issues from multiple religious perspectives and philosophical perspectives is to examine how these systems of belief are being used by people. Now, I'll often have students say, "Well, I don't believe in God." And it's like, that's fine. You don't have to believe in anything. But people who do some powerful things. So understanding where they're coming from is really, really important. And to figure out, people use religious traditions, philosophy, spirituality, to figure out who they are, who they want to be, and how they want to live in this world. And those three questions, I challenge all of us, and I say myself included, to think about that on a daily basis. I'm continually saying, who is it that I want to be? How am I responding to a situation that's frustrating? I can yell and scream, or I can respond in a more gentle way, but that's a choice that I make, right? And if I mess up, do I just give up? No, because life keeps going on, right? So okay, I messed up on that, let me see what I can do next. Religious beliefs, I think that's important to understand how we do that, to figure out who we are, who we want to be, and how we want to live in this world. Now, ethics, so I'm an applied ethicist, it's all about decisions. It's about the decision itself and the process by which we make decisions. And different religious traditions can give you different ideas. You can come to the same answer, but you might get there on different paths. And the pathway itself is really, really important. So for some people, their decisions are strongly influenced by their association with that institutionalized formal religious tradition. For others, it's not. For some, it's that sense of spirituality or philosophy or other elements where they get that idea of how they should live and who they want to be. Again, the key thing is to be critically mindful of how we're making choices. So my answer to the question of what is the role of religion, morality, and ethics in public life is that they are central. They are going to be the determining factors for the type of society and public life we're actually going to have. And it matters what our principles are and how we live them out. Because these factors are often what guide people or groups, individuals, or communities, and how they ought to live. It influences their way of life and their dharma, if you prefer. So, it was mentioned I worked as a registered nurse for 10 years in the hospital. And as I was working on my PhD in religion and social ethics, I was combining my experience as a nurse with what I was learning in religious studies. Now, in the United States, and that's the context obviously out of which I've been working, most of the bioethical discussions are grounded in Jewish and Christian perspectives. And that's wonderful, because there's great wisdom that can come from Jewish and Christian traditions. However, I was interested in bringing additional voices into the conversations. And in the United States, we have Hindu, Buddhist, Jains, Muslims that have been living in the U.S. for 6, 7, 9+ generations. They are part of the fabric of the United States. So why not benefit from the wisdom of these traditions? And that's, again, I think that's really important. So in my earlier work, I took the birth narratives of Kunti and Gandhari's children in the Mahabharata, and I pulled out 6 principles that were important to many within Hindu traditions or Dharmic traditions. And I built a Hindu perspective on assisted reproductive technology. Then about 5 years ago, I was asked to contribute to an edited volume called Religion and Ethics in the Neonatal Intensive Care Unit. This book was talking again about religion and ethics, but it was in a specific setting in the public life, specifically within a hospital and more specifically within the NICU. The purpose of this edited volume was to encourage healthcare professionals to become familiar with the religious traditions of the faith communities with whom they were serving in order to be able to offer more quality healthcare. And I will argue that without an understanding of religious traditions, you cannot offer competent healthcare. You have to understand people's religious traditions. My chapter, Shiva's Babies, began with a discussion on cultural humility. And I can do a whole little workshop on that. I've done workshops across the country on this. And that's where you emphasize the importance that no religious tradition or cultural tradition is monolithic. You all live in families. You have siblings and parents. You've grown up in the same culture, and yet some of you see the world pretty differently than the rest of your family. Right? My brother and I are very close, and we share a common root, but we're very different. Right? So when you talk about religion and culture, you have to remember that each person has their own expression of it. No religious tradition is monolithic. So I took the principles that I had developed previously and I applied them to the care of the babies in the NICU. As part of this chapter, I sent out a survey across different places in the United States asking adults, so they were over 18, who self-identified as Hindu and who were living in the United States to answer some questions about what they would want healthcare professionals to know about their tradition. The last question in the survey asked, what would be important for neonatal intensive care healthcare workers to know about your beliefs and values? Many of the responses were quite touching, especially when you consider the context of the NICU. A survey participant wanted healthcare professionals to know, and I quote, that Hindus care as much about infants in such situations as members of other religious communities, but also they may tend to be more pragmatic in a situation that requires treatment to be discontinued. Again, it is not callousness, but an acceptance that death is a natural part of life and that rebirth is a certain reality. Imagine if you were the parents of an infant in the NICU who is at the threshold of death, and you're stressed out and the grief that's being experienced by the families. This quotation reflects an added burden, a concern that the healthcare professionals might be unjustly judging them for the way they're responding to the situation. In the NICU, it's a very difficult place, and having an understanding of people's religious and philosophical beliefs is imperative. Now, I presented this paper at a NICU conference, and it was attended predominantly by white, US born and raised, and while I don't know, I didn't do a survey, but I would hazard to guess that most of them either were or were very familiar with Christian traditions. So what I brought to the table was a little different. Towards the end of the presentation, I shared the following quotation from a survey participant, and I quote, "I do believe that life is precious, but I also believe that life is but a part of a journey that my soul experiences. As I get older, I get more convinced that death signifies the beginning of another phase of my life, not its end." Now, as I read this, I suspect that many of you are hearing something that feels very familiar. However, the people in that audience, it was very different. When you look at understandings of what happens after you die in Jewish and Christian perspectives, this view is very, very different. I ended the presentation with the following explanation, and now I'm kind of quoting myself. The reasons that the title of this chapter is Shiva's Babies is because Shiva, the Lord of the dance, creates, sustains, and destroys the world in his 108 dances. Those of you caring for the NICU infant at the threshold of death, hold in your hands this process. I ended this because I was trying to show them that something in which they are engaged on a daily basis can be interpreted and viewed in many different ways. And I shared this perspective that was probably unfamiliar to most of them. And in fact, at the end of the session, a number of nurses and physicians came up to me and started talking to me and talked about how they had never thought about that. They had never thought about how somebody's religious beliefs could intersect with what was happening in the hospital. Now, me as a religious studies scholar and a nurse, I was like, how could you not put the two together? But some people don't, because they kind of compartmentalize. And then they went on to share the experiences they had and the insights they started having of what other people might be experiencing. I provide this specific example on how religion is functioning in public life because for healthcare professionals, and actually I'd say for all of us, we need to pay attention to understand the role of religion, morality, and ethics in the lives of patients or the people that we're interacting with, to be able to deliver in the healthcare professional better care in the most effective manner, but in our case, to be able to better interact and understand those with whom we're interacting. And as we all know, this world right now, I mean, I'll speak for the United States, is really polarized. So how do we talk to people who have a different worldview? We're not going to come together and have any kind of peace if we can't learn how to do that. Let me close with some wisdom from Ushadi. She's one of the founding sisters of the Brahmavidya Mandir Ashram in Maharashtra. And I've been going there for about the last 20 years, and I've been living there. And Ushadi and the ashram are followers of Vinoba Bhave. And they talk about how he used to say, religion and politics are of the past. And in this case, he is meaning institutionalized religion. Now, he says, is the time for science and spirituality. Science is dealing with the outside, physical, visible world. Spirituality is the inner world, again, that metaphysical, transcendent. He talks about science and spirituality. He says science is the speed and the power of the engine of the car. Spirituality gives it its direction. Think about that. Think about that. And that's our Vinoba Bhave, right? It's very, very important when we talk about what is the role of religion and ethics in public life. One of my favorite quotations from Ushadi is her definition of spirituality. She says, so my simple definition of spiritual life is simple living and high thinking. Unless you have simple living, you won't have high thinking. High thinking means in life, not only in words. So our high thinking is being combined with how we live. This is the simplest definition of spirituality. And now the bell is gone. I always keep that last phrase in the transcript because I love it, because it reminds me, she and I used to meet just before dinner. And we would be in these deep theological, philosophical conversations, and then the bell would go for dinner, and I'd be like, darn! And she's like, time to go. Time to go on to the next thing. Because life keeps going on. And we can get so involved and caught up in our little academic worlds that we forget to live and move along with life as it goes. I love this line. Ethics, morality, and spirituality and religion are at the heart of how people choose to live in this world. The choices we make on a daily basis are going to determine the type of public life we have, that we create for ourselves, our family, our communities, and the world. So may we remember this idea of simple living and high thinking and create a world in which everyone may flourish and thrive. Thank you.